Thank you again very much for being with us this evening. My name is Kimberly White, and I work in the Office of Alumni Relations. We are happy to be partnering with the School of Nursing to bring you a talk on resilience, understanding it, teaching it, and living it out during COVID-19. Thank you for gathering with us this evening, and especially lots of gratitude to our active nursing and healthcare professionals who are working tirelessly in this season. A few of our panelists today even just got off work and are joining us this evening, so we so appreciate it. We have a great program. I would like to invite you to be involved by conversing in the chat box, which you will find at the bottom of your screen. We're going to do our best to make time for questions at the end of the presentation, so please be typing your questions into that chat box. And the session is being recorded for further viewing, and you will also have an opportunity to fill out an evaluation form to receive continuing education credits. I would now like to invite up Debbie Hawley, our Nursing Alumni Auxiliary President, to get us started. Welcome, Debbie.
Thank you. I'm thrilled to be here today. It's great to have everyone with us. I was just talking to Sylvia Potter, who's a name I recognized, who's in Vanuatu, I believe. I think the New Guinea area. So we're glad to have you with us. And this is a great opportunity that we can at least do with this kind of a program to know that we have the opportunity to get more people together in a timely fashion. I'm thrilled to be here. My whole role and the reason I'm involved with Nursing Alumni is I want to do everything I can to keep us connected and keep us connected with our students and what's going on. And I have some individuals that join me in that effort. I believe Carol is on, and she's one of the board members that's joined me, as well as Rose Johnson, who's going to come up briefly. And she's the techie person in the crowd. And so I'm going to ask Rose to kick us off for the rest of our time here together. And thanks again for joining us.
Great. Thank you, Debbie. Yes, I am. I kind of run the social media stuff. So I'm the face behind our Instagram accounts and Facebook accounts. I'm going to send you all that info right now. Though if you search PLNU Nursing Alumni, you'll find it. Yes, first of all, I want to thank all of our frontline workers for your tireless efforts. And we have the opportunity to hear from 3 today. So I will get right into introducing them. It is my honor and privilege to introduce them. So we have Cassie Spagnola, class of 2010. She works in the ED at Huntington Hospital in Pasadena. And fun fact, she has worked as a flight nurse and as a nurse at Disneyland. So very cool. We have Leslie LeBaron. She works in radiation oncology at a Kaiser Cancer Institute in Cancer Treatment Center in the Bay Area. Kind of a mouthful, Santa Clara Cancer Treatment Center. And so she is going to share her experience. She has experience in the ED and has cross-trained and helped out pretty much all over during this pandemic, from med-surg units to COVID-10. So she has a lot to share with us. And I think congratulations are in order. Leslie, would you like to share your news with us?
Yeah, I just found out I was pregnant 16 weeks ago, right when the surge was hitting. So that affected some of the places I did work over the last few weeks.
Yeah, congratulations. You're now being resilient for 2.
Yeah.
And then lastly, we have Carly DeCieger. She is, Leslie's class of 2011. I didn't say that. Technically 2010, but technically 2011. Carly DeCieger is class of 2016. She works at, well, I guess technically right now it's a COVID ICU at UCSD Jacobs in San Diego. And she is adjunct faculty with our sophomore team. She was not able to be with us live tonight because she actually has a shift. So we have a pre-recorded message from her for you guys right after this section. So let's get to it. Cassie and Leslie, can you describe what this year has been like for you and how has your mental health fared during this pandemic? Cassie, let's start with you.
Hi guys. So as Rose shared, I'm in an ER up in Pasadena. So we were thrown in pretty quickly, obviously, to the unknown of COVID back in March. And I actually had come back from maternity leave at the very end of February. So I think I was like 2 weeks back into working, and all of a sudden it was like, oh, there's this virus, and it seems like it's kind of like the SARS that was going around, and it was unsure like how anxious, how prepared do we need to be? What do we do? And it seemed like, and it still feels like that today, every day you go to work and it was like, okay, well, today it's just surgical masks. And then tomorrow, well, you have masks, or if they have a cough, they have a mask, but then, otherwise you don't need a mask. And then now, no, everyone needs N95s. No, just these people need N95s. Well, switch out, it's just constantly a new message every single day. So that was in and of itself an interesting thing to come into work every day, kind of trying to figure out, okay, what's changed today? What am I supposed to wear? Do we have N95s? I think just that initial lack of PPE was a huge thing in the beginning, not knowing if we were going to feel protected and have what we needed. And we were really lucky to have a lot of community donations coming in with PPE. And but it's still, most of us in the ER ordered our own like reusable N95s that we could wash and wear again. So that was part of the process of this last year as well, just kind of figuring out how to keep ourselves safe, or, feel like we could be safe and then come home to our families. Another thing that was interesting too was coming back from maternity leave and then having to pump at work and trying to be sterile and figuring that piece out. And then because I was obviously being exposed, we weren't sure to what level. In the beginning, my normal childcare was my in-laws who live in this area, and everyone was so scared. We just didn't know, especially during the initial lockdowns, that no one was really able to watch our kids. And so I have a 4-year-old and now a 1-year-old. And so it was just a lot of adapting in the beginning. My husband used to go into the office. Now he's been working from home. And so he's trying to work from home. And when I go into a shift, he has to watch the kids and work from home. So there's just been a lot of changes. It seems like constantly something is changing. As far as the actual ER, our numbers actually dropped significantly in the beginning. I think so many people were staying home. So we're a major trauma center. So we had a lot less traumas. There's a lot less cars on the road. We had a lot less people coming in for things that really didn't need to be seen in the ER that were doing. All of a sudden, they were able to call in and do appointments with their doctors. And I think people were just scared to come in. So there was, unfortunately, some of those people that needed to come and then were coming too late with a stroke, or days later with symptoms that should have been seen earlier, but they were so scared to come to the ER that they weren't coming. So there was a lot of that stuff that was interesting. And it was just like, don't come if you don't have to, but if you have to, come, and trying to get that message out. And also just trying to deal with all of the anxiety that goes around, not only in the ER, but then the ER with so many unknowns. So.
And your mental health? I mean, I'm assuming all the change and uncertainty took its toll, I imagine.
Yeah, I think personally, I think that I was very lucky. My children are young enough that I didn't have to try and deal with school with them yet. So I was very grateful for that. I think that helped a lot. And I have a good relationship with my husband. So I feel like I wasn't at home isolated by myself, which helped a lot. And honestly, going into work, I felt like was a blessing in and of itself, even though it was like, oh, I'm going into a place of anxiety and we're not sure. But at the same time, it was like, my routine didn't change that much. I still got to see my coworkers on a day-to-day basis. I still went in and had all this thing. And then I'd come home and my husband's like, I need groceries, I'll go to the grocery store. I haven't been out of the house in days or weeks, And so it was almost, in a sense, I felt like better my mental health because I was able to kind of stay into my routine a little bit. And me personally, I do okay overall with change and anxiety and things like that. And so I was able to, I feel like, roll with the punches fairly well. So even though there was a lot going on as far as the unknown, overall, I feel like, yeah, I feel like overall mental health wise, I was able to talk through a lot of things with my husband, and a lot of Zoom calls, and my family's all in Oregon anyways, so we were used to FaceTiming and Marco Polo, and so we just kind of continued on with that. And I was I'll speak more to it with your next question, but my faith has played a huge piece in my mental health as well. So
sounds like you're already naturally resilient or have built up those skills already. So that's great. How about you, Leslie?
I would iterate Cassie in just like the changes that were occurring in the beginning that was the most exhausting piece. Showing up to work every day, not knowing what the new policy is going to be today. Sometimes policies changing twice in one day. And then the challenge that management and upper management had disseminating that information down to those of us that were actually working with patients was exhausting. I mean, I came home every day just like, guess what? Like, now we're wearing N95s, but we don't have enough. So we're wearing, just all the same changes that everyone else was going through, but we were going to work every day trying to figure it out. I was pretty in a unique spot throughout this COVID time, just because I work in outpatient radiation oncology, so cancer treatment, which cancer shouldn't essentially really change. It's not a virus. The number should stay the same. And yet our numbers just crashed massively. A lot of people stopped coming in for treatment. They stopped going in for biopsies. Our diagnoses decreased. So right away, I ended up joining the COVID float team, which was really cool because I ended up getting trained. So working at the swab center, so the COVID tent. I went back to the ED. I got trained to work in med-surg, which is totally new. I had never done that before. And eventually I went on and worked with the COVID surveillance team, which involved calling patients who had been diagnosed with COVID but weren't sick enough to go into the ED, and monitoring their care every day, every other day, to help manage their symptoms from afar. So as someone who now specializes in oncology, I was put in a position where I got to still be really closely connected to the COVID fight, to the battle with all of that. And it helped me stay up to date in what's happening both nationally and within our hospital system with all the protocols and policies and changes. So that was really interesting to me. That being said, it was like starting 5 new jobs in 1 year. And no matter how much nursing experience I had, every time you start a new job, can be exhausting mentally, emotionally. It has its own challenges to it. And so when I'll mention resiliency in a little bit, but how I managed a lot of those changes, it was a lot of adapting throughout the time. Though really interesting and honestly an exciting time to be in healthcare. So yeah, that was kind of my experience. And then mental health wise, like Cassie said, I was just so grateful to get out of the house every day. That being said, I worked the first 30 days, like March 12th or 16th, until mid-April, 30 days straight. And that took a huge toll both on myself and my husband. So that we really had to learn how to navigate both of our schedules and lives changing. And the hardest part was actually my family stopped wanting to see me because they were afraid that because I was in healthcare. So I went from seeing my little 5-year-old niece and nephew every weekend to not seeing. I've seen them twice this entire year. And so just kind of navigating conversations with family about what's appropriate and their fear levels has probably been the hardest part for me.
Absolutely. Absolutely. Well, we've only got a couple more minutes for this section, but if you could share your personal practices for maintaining resiliency and what advice you would give all of us for maintaining resiliency. Leslie, if you want to lead us.
Yeah, so for me, this was both. It was two-part. It was the very tangible things that I did to maintain my mental health, and then the philosophical. In a very practical sense, I learned in that 30-day stretch of only working that it is absolutely integral for me to have movement and sunshine every day. So with gyms and stuff closing, I found that if I walked to and from work every day, I was so much happier. And for me, it's a 3-mile walk each direction, but it gave me sunshine, it gave me movement, it gave me time to feel like a human before an employee or before a nurse. It gave me time to process my day so I didn't take it out on my husband, and time to read books. Scheduling very intentional time with my husband once a week because his life was going through as many changes as mine was. And then just philosophically kind of really embracing for me a growth mindset. So every time I started a new job, in these new positions, it like triggered all these feelings of being a new grad and feeling inadequate and incompetent because even though I had 10 years of experience, I've never been on a surveillance team before. Like I've never had to swab someone's nose in a pandemic. And so
novice, here we go again.
Exactly. But looking at each challenge as just a problem to be solved helped me not be so burnt out. And it helped me not to see each challenge and shortcoming as proof of my intelligence or my skill or my ability as a nurse. And instead, I was like, okay, today was tough. How can I learn from it? How can I adapt? How can I change? And so approaching everything with that growth mindset was like fundamentally different than how I've typically operated in the past. So that was kind of and I'm still navigating through a lot of changes that are going on.
That is such good advice. Thank you. And Cassie?
Yeah, so I definitely spot on with Leslie's being outside thing. That's a definitely huge thing is getting outside, taking the kids for a walk, being in the sunshine is a huge thing. But the number one thing that I had for me here was my faith and how it really affected the way that I was anxious or not anxious. And just going back to scripture for me, it was just so foundational. My church did a really good job of, especially in the beginning and continuing, everyone's been adapting, but in the beginning they would send out videos like a couple times a week, sometimes 3 times a week of just like encouragement. We're here for you, whatever. And then my husband and I lead a Bible study, and we've had to move to a Zoom format, but it's still been so nice to have that and just feel like you have a sense of community, even though, like Leslie was saying, it's sometimes hard to see family and see other people, as often as we'd like. Just having some way to really connect with people. And I think especially in a way that's non-nursing, as much as I love being a nurse, I think that it's really important in order to be able to stay as a bedside nurse, to have hobbies outside of nursing and other things that that you're passionate about, that you can go and be like, oh, hey, I am a nurse and I love, taking care of patients, but I also really enjoy, we go out like motorcycle riding in the desert. It's a great socially distanced activity, and I love being out in the water, like kayaking or, anything like that. And so just things that you can do that keep you, that are completely outside of your work description, and just keeps you grounded as well. And then one other thing I had is that I think sometimes you can go in and you have really strange and unpleasant interactions with patients. I think especially in the beginning, it was easy to take it personally, like everyone else is coming in very anxious and like, oh, if I'm here in the ED, am I going to get COVID? And who else has COVID? And where are your COVID patients? And then they take it out on you. And I can't tell you how many times I get yelled at on a day-to-day basis. And
before COVID, I'm sure.
Just
now
learn it. Well, yes, exactly. Yeah, this isn't solely a COVID thing. And some of them are completely not related to COVID at all. But just learning okay, they're not yelling at me. This has nothing to do with me. They came in anxious because they're having these symptoms that are bringing them to the ER, and there's a pandemic, and who else knows what's going on in their life, and just kind of learning that, like, okay, how can I diffuse the situation without taking it personally and without taking it home with me? And I think that's been huge.
That's great. It's good advice for family conflict too. Thank you guys Thank you guys so much, especially for your faithfulness to the nursing profession and to this fight against COVID. And I've just so enjoyed hearing from you and been blessed by your experience and your advice. Now we're going to go into our interview with Carly. So that video. Well, hi, Carly. Thank you for joining us today, even though ahead of time.
A little ahead of time here.
Yeah, exactly. Would you mind introducing yourself for your fellow alumni, including your graduation year and where you work?
Yeah, so I actually graduated from Loma in 2016 from the nursing program, and then currently I work at UCSD in their ICU critical care setting.
And you've been there this whole time through this whole pandemic, so in the COVID ICU.
Yeah.
So can you describe what this pandemic has been like for you? Maybe give us a snapshot into what a typical day is like.
Yeah, so typically before COVID, we were the medical surgical ICU, so we saw a really big mix of like oncology, transplant, critical care surgeries, all of that. So we had a really constant changing of pace in our unit baseline. And one day we kind of came to work and they're like, congrats, you guys have been designated as the COVID ICU. At the time, I think a lot of us thought this was going to be a bit of a shorter experience than it's been. A lot of us kind of started out with like, this is a sprint mentality, not realizing that it was going to be quite a marathon. So for like, at the early part of the pandemic, it was very much like every day was different. Like, we didn't know still at that point, like how exactly things were transmitted. We didn't know exactly what our PPE or like what masks we were using or which ones we were reusing, like all that good stuff. And overall, our hospital did a really good job of trying to clarify all these things. But what that looked like was like emails and policies that were like getting printed out every day. So like every day we came to work and it was so different from the day before. Even like transporting a patient down to CT with COVID, like how do we do that safely? Well, how we did it safely one day and then we'd come back the next week and it would be different. So I think those early stages were just constantly like, I need to be flexible and today is going to be what it's going to be and just kind of adapt as we went. While also trying to like put down the things that were really scary because we didn't know so much. So just kind of like finding the in-between of I need to do my job, I need to do it well, but it's also totally different than what my job looked like a month ago. And then one of my favorite things that happened during the pandemic was I had been trained to charge nurse like 6 months prior in the case of an emergency where there was like no one else to do it. So one day I came to work and we had a bunch of sick calls and I showed up to work and like, oh, you're charged. And I was like, oh my gosh, I trained for this 6 months ago when our process was totally different. But sure, like, why not learn how to do charge in an ICU in the midst of a pandemic? Like, this is a really great experience. And my managers were great and they kept in contact with me all night. And were super like available. But the next day, my manager came in, he's like, thank you so much for doing that. Don't worry, you won't have to do it again for like at least a year. And then I came back that night and I was charged again. I was like, wow, that year went really quickly.
Wow.
I think it's just constantly, we had so many nurses have to kind of rise to the occasion and take on new duties. And we combined with our cardiovascular ICU for all of the ECMO patients. So the cardiovascular ICU specializes in the ECMO and we specialized in the COVID. So our two units had to kind of come together, which has actually been a really neat experience. We've become really good friends with those staff members to kind of work together with these critically ill patients and kind of bring the two things that we are both best at together to provide the best care for these patients.
Wow.
Yeah. So it's fast paced, but it's good.
Wild ride. That sounds so stressful to have everything changing so often. Have things leveled out a little bit? I mean, they're still stressful, right? But
yeah, I would
you
say
guys have a routine?
Definitely leveled out. We've gotten used to it. I think our units, because this is all we've done now for almost a year, we've gotten really into a good rhythm with it. the December wave was pretty stressful on our unit because the hospitals were super full, and we were trying to decide, like, how do we, you know, use the few beds we have best for our hospital when you have ICU patients, you know, in the ER, and we're a higher level of care hospital. So we get a lot of transfers from smaller hospitals that don't have the capacity or the equipment to do certain things. So how do we offload our community hospitals? How do we offload our ER when we have a limited number of beds ourselves? So I think December was a pretty stressful month for our unit, but overall, I think that at least now we have a very good set of like how we care for these patients, and our PPE issues have, you know, knock on wood, have resolved, and we're able to use things appropriately now.
Good. Glad to hear that. How would you say your mental health has fared during this whole experience?
I would say it's definitely kind of like an ebb and flow. I think there's been most good times and then also really challenging times. I know specifically for me, like mid-June is when I think I really realized that this was going to be a really long-term haul for our country and our world, but specifically our unit. It was kind of, June was kind of when I realized, like, I'm seeing a lot of really, really sick people, and I can only do so much to help them. And this is going to be going on for a while. Like, our unit used to be half surgical patients. So although we had long-term critically ill patients with our medical side, our surgical side was very fast-paced and very high turnover, which was good. We'd see people get better. We'd see them get off their ventilators. And I think June is when that really hit me personally, that like some of these patients had been with us for, you know, months, and just seeing that toll on them and their families was really hard. And then I think the other thing that was really challenging for my mental health was, I think I had to kind of stop and realize that the whole world wasn't seeing what I was seeing within those hospital walls. I found myself getting extremely frustrated, extremely like just agitated at the community when I would see people going out and doing things and meeting with friends, and it was so frustrating, and I would just like spiral in that frustration, and like, don't they understand that like people are dying constantly right now? And I think I had to pause and realize like the world wasn't seeing what I was seeing. I was seeing a very small, I don't want to say small portion because it was a very big thing, but people didn't have that same experience as I did. And it's very easy, I think, to hear about death numbers, but when you know the names and the families and the photos behind those peoples and the story behind those people, it's a very different experience when you hear death rate, because you're like, oh, there was 4 people who died in San Diego, and like I personally knew 3 of them. You know what I mean? And so I think that was really hard on the mental health component of it, which really caused me to have to like pause and reset and say, like, I don't understand, or they don't understand what I'm seeing and what that looks like on a daily basis. And once I started, I think, to have more compassion and empathy for the people in my community, I think that really helped my mental health a lot, because I was no longer holding them to the same experiences that they haven't had, you know?
Right.
I don't know if that makes sense, but.
Oh, no, totally makes sense. Yeah. That's all the questions I have for you. Is anything you want to add? Anything we didn't touch on,
I think the biggest thing is just to like remember to give yourself grace in this whole thing, and there's going to be good days and there's going to be bad days. And for me, like the biggest change in heart for me has been when I started to really look at everyone differently and see what experience is. Because like, for instance, our teachers right now are having a very different experience than the nurses, you know, versus those who have been working from home now for a year. And I think when you take a moment to actually put yourself in another person's shoes and say, like, they don't understand this component of what I'm going through, but I also don't understand this component of what they're going through. And having that compassion for our community, I think, is just so important right now, because we're all experiencing a different hard, you know. What I find difficult, someone else may not experience, but what they're experiencing is really difficult. I am not. So I think just having that compassion for our community will allow you to have, number one, more peace and more understanding for the people around us.
Wow, that's really, thank you for sharing that. I needed to hear that today, actually, so thank you.
Yeah.
That's great. Thank you so much, Carly.
Yeah, of course.
It's been awesome.
Yeah.
Thank you so much, ladies. That was so great. I wanted to give Barb a few minutes to give us an update because she's had a few changes of a different kind in the COVID perspective. And yet, if we were together for alumni breakfast or any other kind of thing, Barb would be giving us a bit of an update. So I said, please do that, Barb. And be sure to tell everybody where you are. Take care.
Well, you know, as I'm hearing Carly, the perspective that she had and shared about, you know, how it's her perspective and her world and her vision and what she has seen. And, you know, last March 13th, the School of Nursing and the university changed. We went from a totally face-to-face program to 100% online in 1 week. And I don't know if you all realize that process of things, but that was a Herculean feat that in 1 week's time, we were able to get all of our theory classes into an online format. Clinicals just stopped. We would get a notification from one hospital and then another and then another and then another. And for me, it was the week of March 13th, you all were saying, you know, how you had policy and procedures changing 2 to 3 times a day. I had university things going on and changes 2 to 3 times a day. And so it was just this conflict and this chaos. And as I looked at that, and as it is now a year behind us, what a wonderful staff we have, what a wonderful faculty that we have. And our current students have been wonderful with being flexible and adaptable. And we've really had to call on some alumni to jump in the gap on some things, and they're really stepping in to do that. We are struggling with getting clinical placements, and clinicals, guys, look very different than they did when you were in school, let me tell you. And so it's going to be, it's a wonderful new challenge and a wonderful new transition for nursing education. I think it'll be forever changed. Don't know what that looks like yet, but I just can't imagine that any nursing is going to go back to 100% face-to-face. I can't imagine that clinicals are going to be the way they were. So anyway, all kinds of new things. And the things going on in California, AB 5 pretty much took care of my husband's business. And so with him not working, we hastened my retirement a little bit. And so I am right now in Bartlesville, Oklahoma. We've retired. I'm going to be retiring this summer officially, and looking forward to that next chapter in my life. We've been married 40 years, and for the first time, we're in the same closet, which is a big deal to me. We are closer to family. In fact, this past weekend, we had, for those of you that remember Harvey, and his story of when he was born, he had AV malformation in his mouth, and he's a thriving 7-year-old little boy, and got to see him this weekend with his brother and sister. And so we're looking forward to that. And we're not quite sure yet what life has in store. But I am confident, and I know that God is leading us all the way along. And it has been my joy to spend these last 21 years in the school at Point Loma Nazarene University. I have grown. I have learned so much about myself, about my faith, about nursing education. Many of you are hold special places in my heart. And Sylvia, I think I've met you once, and but your name has been a part of this School of Nursing since I started here in 1999. So your story, your legacy moves on. Debbie Holly, you are a leader and a formidable a woman who you don't meet a stranger. And I thank you for leading this alumni organization. So many of you, you know, the bad thing about being virtual is that I can't give you all a hug, and I wish I could give you all a hug. And one day we will, one day we will. But I am thrilled that Dr. Michelle Ringen will become Dean of the School of Nursing. She and I started at Point Loma in 1999. And she has been a wonderful friend and colleague. And I know that her vision and just the way she thinks, her creativity, her innovation, the way she questions things will take the School of Nursing into this wonderful next chapter of post-COVID, whatever that might look like, and then leading students into enhancing their professional nursing practice. So I thank you, Michelle, for being my friend. Thank you for your willingness to come alongside and be a part of this next chapter in the School of Nursing at Point Loma. But again, thank you all. I love you all, and I will miss you all. But I will be back in April, and I'll be back for commencement, whatever commencement's going to look like. So anyway, see you later. I'm going to be introducing. No, Michelle, you're going to be doing the next thing.
Yes. Wow. Thank you. Thank you. I'm sitting here and ever since the nurses started speaking, I'm just sitting here just grinning the whole time. And I try not to say this to grown women and men, but I'm just proud of them. You know, not only as faculty, I'm going to sit here and I'm going to put my family hat on. You know, when you talked about the December numbers, my brother was one of those December numbers who was ventilated, kidneys failing, everything. And I'm proud to say, because of the nurses that have taken care of him, although he is still requiring 24 hours of care and is technically institutionalized, he is doing well. And I owe that to the nurses that took care of him and the doctors and everyone else. So thank you, number one, for who you are, who you've become, and I'm just so proud of you. That's all I can say. But enough of me. At this time, I'd like to introduce our next presenter. You'll be able to hear from me more later, more to come later. So our next presenter is Dr. Kim. She received her PhD from the University of San Diego, and she joined us at PLNU in 2000. And she teaches BSN and MSN students and also grad students or doctoral students. She also taught at Southern Connecticut State University as well as Texas State University. And she recently returned to PLNU and is just now teaching our MSN and our DNP students. Dr. Kim is active in research scholarly activities. That's an understatement, by the way, and is the original author of the ABRAT Aggressive Behavior and Risk Assessment Tool that can identify potentially aggressive or violent patients in acute care hospitals or long-term care homes. Currently, she's in the process of incorporating the ABRAT into EPIC EMR to test its usefulness in identifying potentially violent patients in emergency departments. Since the COVID-19 pandemic, Dr. Kim has led 3 studies to assess coping mechanisms and mental health burnout among healthcare workers and nursing students. Dr. Kim, please share with us your knowledge.
Thank you for this opportunity sharing our study. So I'm going to just talk about a study that has been done last year. The title was the Predictor for Mental Health Among Nurses During COVID-19 Pandemic. The study was conducted in collaboration with 3 other nursing faculty at School of Nursing. And before we Okay, so I'm going to give a quick timeline related to our study. As we all know, The first case was identified in Washington State in US in January 21st. And 2 months later, March 2020, WHO issued that is the pandemic declaration. And a week later, March 19th, California order is the first state actually in US that issue mandatory lockdown. So our study was conducted a month later. So when you look at timeline, our study was done actually 3 months after the first case in United States. And this graph shows kind of daily new cases from February last year and February this year, about year span. And you can kind of see up, peak, and coming down. But when we conduct our study, it was right here, about less than 50,000 daily cases at the time. And we heard about this poor mental health among nurses from our wonderful speaker today. But kind of putting together, we all know this SARS-CoV-2 virus is allowing very rapid person-to-person spread. And then actually the COVID-19 pandemic was the worst one since Spanish flu a century ago. And we all know that it overwhelmed the healthcare system. And it is not surprising how the nurses, healthcare workers experiencing high levels of stress, burnout, poor mental health, especially anxiety, depression, insomnia, and even PTSD. And we heard all those, what are the common causes? We heard from sharing our personal story, but I'm just want to add one more. At like last April, we didn't have any effective treatment and or vaccine at the time. So that really increased the level of poor mental health among healthcare workers. But this study is really interesting. Study was done among frontline healthcare workers during 13 to 25 months, so about 1 to 2 years after 2003 SARS epidemic. Again, SARS was not pandemic level, it was a regional epidemic in Canada. These authors want to see, okay, what happened to the long-term impact on mental health among healthcare workers? So they did a study comparing frontline, meaning who took care of SARS patient, and compared to non-frontline healthcare workers, 1 or 2 years even later. And they found out frontline healthcare workers were still experiencing higher level of burnout, higher levels of psychological distress, and even PTSD, even up to 2 years. And in this study, they also found that inadequate organizational support was a significant predictor of poor mental health during that epidemic. And the authors made a recommendation for organization. In that article, says that organization need to provide effective staff support during the epidemic and also train staff in preparation for future epidemic, meaning proactively need to have trained staff for future epidemic. But we all know when we got hit by pandemic last year, I don't think we were prepared. So this article is very interesting that really highlight that the poor mental health during the pandemic is immediate, but also it can have a long lasting up to 2 years if it's not taken care of during the pandemic. So we conduct our study in April last year. Most studies were from China because we are kind of in US, we're about to having the event. So we didn't have much studies that published in US. And also there was a little is known about what about the relationship between various coping mechanisms, how the coping skills affect mental health, stress, anxiety, depression. We want to look at the relationship because if we know that association, how much that influence, then such knowledge would help organization identify and provide most kind of targeted, modifiable, more mental health support intervention so that it can improve and sustain psychological well-being during, even after COVID-19 pandemic. So that was the rationale for our study at that time. So our study aims, in our study was not just knowing for mental health during the pandemic, we want to know how much changed compared to pre-pandemic. So we want to compare mental health status before and during the pandemic. At the same time, we want to explore impact, the association between coping mechanism, but we select 3 coping mechanisms: resilience, spirituality, and family functioning, meaning family support. How much that each coping mechanism impact the mental health among nurses. But in our study, it's not just anxiety. We want to look at extreme case, such as moderate to high level stress, moderate to severe anxiety, moderate to severe depression, because those, the extreme cases, actually based on the tool that we use. If the score is above 10 and higher, they require kind of further psych evaluation. So we want to focus on those nurses having kind of moderate, severe symptoms of anxiety and depression. So it was a cross-sectional online survey from April 20 to May 10th. We decided to do study among our nursing alumni because it's a time sensitive. So we contact our alumni association to send out invitational email to all Point Loma alumni. And then we also had some gift card for those 10 randomly selected participants after the study closure. Again, we use various instruments that measure resilience, spiritual support, family functioning, satisfaction with the family functioning, and perceived stress scale. And then, you know, these tools are widely used: GAD-7, PHQ-9, that measure anxiety and depression symptoms, and few demographic data. We utilize various data analysis procedure. So these are the results. When I talked to Alumni Association, we had almost 1,400 alumni from Point Loma, from bachelor to all the way doctorate degree last year. So they send out the email using Point Loma email address. And in fact, about half of them, alumni, receive and open the email. So that's quite a good response. But we are only able to include 320 sample in our study because a lot of them were incomplete data entry. So mean age 33 and mean RN experience 10 years. Most of them are female, but about 75% had a BSN degree. And interestingly, about half of the participants had already patient care with the COVID-19 patients. So this slide, the graph kind of very interesting. We are compared the mental health before, white bar before pandemic, cross hatch bar during pandemic. And I mean, we all know that the level increased, but look at the anxiety, 4 score, median score 4 to 8, depression, median 2 to 6, but still, when you look at the median score, they're kind of mild, it's okay. But remember, we want to look at those, we had a severe, moderate, severe anxiety, moderate, severe depression, and then just looking at in this slide again, before the pandemic, only 8% report they're experiencing moderate to severe anxiety symptoms. But during pandemic, it went up to 43%. So it's almost 5-fold increase incidence of moderate severe anxiety during pandemic compared to the pre-pandemic period. What about depression? Only 6% reported having a moderate to severe depressive symptoms, but during pandemic went up to 26%. It's almost five-fold higher increase. So you can kind of see the really heightened anxiety and depression during pandemic. This is kind of correlation, kind of give you a big picture, but just kind of one few things kind of look at here. Age. And when you look at an age, all negative relationship, meaning the older the nurses, less stress, less anxiety, less depression. That's kind of telling us. What about COVID-19 patient care? That's all positive. More stress, more anxiety, and more depression. If you look at this coping strategy, having high resilience, high family functioning, high spirituality, is all negative correlation. So it gives us kind of big picture, but doesn't tell us how much that influence, how much will impact poor mental health. So we did multivariate logistic regression. It really tells us what are the predictors, how much influence. It's a very powerful statistical procedure. So it's kind of quick in here. COVID-19 patient care is look at the odds ratio, 2.25, meaning twice, twofold higher odds of stress. If nurses has COVID-19 patient care, it's about 3 times higher odds of anxiety. To give us more specific, how much it will impact, okay? What about resilience? Resilience is the negative, when you see odds ratio less than 1.18, 0.37, it's all negative, lower, it's a lower odds. So when you look at resilience associated with the stress, anxiety, lower the anxiety, lower the stress. What about family functioning, having good, satisfying with the family support? It affects stress, anxiety, and depression. Is all lower odds for mental health. What about high spirituality? It only affects depression. Having high spirituality, it having lower odds of especially with the depression. So kind of all together what that means. So our study was conducted 3 months after the first case COVID-19 in the US. And we found that during the pandemic, nurses are experiencing 5 times higher incidence of moderate to severe anxiety, moderate to severe depression compared to those pre-pandemic periods, kind of see. And especially if nurses took care of COVID-19 patient, that experience associated with a 3-fold higher, more odds of moderate to severe anxiety. So then what happened, the impact of coping mechanisms. So here at the high level of resilience was associated with a 3 to 6-fold lower odds. I mean, look at that, how big is the impact, 3 to 6-fold lower odds of moderate high stress, moderate severe anxiety. What about high level, have a good family support associated with 2 to 3-fold lower odds, lowering odds of, again, stress, anxiety, depression. High level of spirituality associated with 2.6, almost 3-fold lower odds of depression. So our study really shows how much each coping skills influence, impact those poor mental health. Okay, so what does that mean? So we all know nurses during the pandemic experiencing heightened anxiety and depression. But what we found from our study, we identified modifiable protective factor, modifiable coping skills such as resilience, spirituality, family functioning. These factors can actually reduce, ameliorate poor mental health during the pandemic. So what does that tell to the organization then. Organization may consider implementing targeted protective mental health support intervention, such as building resilience. Have a program that builds resilience among nursing staff or healthcare workers, or have a program that enhances spirituality among healthcare workers and support family functioning, like providing childcare, transportation. All those programs can really help reducing the poor mental health among nurses, but it's not just short-term immediate poor mental health. Can also influence long-term, because we saw from previous study that it'll impact longer-term psychological well-being. But we all know that good mental health among nurses will also provide high quality and safe patient care. So these are what kind of our recommendation from our study. So study findings are published in journal Nursing Open in 2021 January issue, just came out. And then now what? Next level. So I just want to say thank you to those alumni who participate in our study. I'd like to take this time to invite you again, our follow-up study. Now, this time we are interested to look into impact of COVID-19 vaccination, how that impact nurses' mental health. Okay, again, it will be a survey, online survey. We are thinking about around March next month. Actually, this time, we're gonna invite Point Loma nursing alumni, but also nursing alumni with American Nazarene University, our sister Nazarene University. So I'm kind of looking into over 500 sample size. So I'd like to look out any invitational email from Alumni Association, and it'll be wonderful. You can all participate so that we can generate more knowledge from our study. So that was my, and I have to go really quick, but thank you for listening. Okay.
Thank you, everybody. I'd like to thank you, actually, thank you, Dr. Kim. I'd like to now introduce our next speaker, who is Dr. Lambert. She received her PhD from the University of San Diego, and she joined PLNU 12 years ago, and she teaches undergraduate students and has been a psych mental health nurse for 40 years, 4 whole decades. That's awesome. She is currently engaged in 3 academic research projects and is the director of the PLNU School of Nursing Resilience Program. This is we are the first school of nursing in the country to offer a fully integrated resilience building program for all 4 years of a BSN program. That's thanks to Dr. Lambert. Her focus of tonight's discussion is the birth of the PLNU School of Nursing Resilience Program, making compassionate care of self a priority in the service of others. Thank you, Dr. Lambert.
So thank you. This has been a really amazing opportunity to hear from our alumni. And, my response, Dr. Ringen talked about feeling very proud. I have to say, I got a tear in the eye of listening to the way that my colleagues interact with patients, feel about patients, appreciate and understand compassion. And I have to say it's been amazing to listen to. What I want to share with you, and I'm going to do it quickly because I'm really cognizant of time and I don't want to go too far over, but I want to share with you a little bit about what the School of Nursing is doing with our resilience program. And I always like to start with a little quote. And I think from listening to everybody tonight, this quote will really ring true with a lot of us. And that is that life doesn't get easier or more forgiving. We get stronger and more resilient. And I think We have visionary leadership in the School of Nursing. We started this program actually, I think the initial program was about 6 years ago, when we noticed that students were experiencing more depression, more anxiety, suicidal ideation, even intent. And we were very concerned about that. So Dr. Taylor asked if I would, look at the possibility of putting together a program to sort of support to be able to identify and to support our students who were feeling challenged as a result of even just entering the program. So I think one of the things we need to start with first is, what is resilience? We keep talking about resilience. And just quickly, it's a self-writing process. And what it does is enables people to persist during times that are challenging, allows them to recover from adversity, and allows them to adapt by mobilizing psychological, physiological capacities so that they are able to utilize resources that are in front of them. So it's not just about bouncing back, and it's not just about learning strategies. It's a whole other way to look at things. And it is a practiced interaction. We thought for a very long time that resilience was a character trait, and in fact, resilience can be taught, and it is recognized now as a practiced interaction that is between the person and their environment. So why do we need to talk about resilience? At this point, I don't need to tell you, but let's just look at, we do have pre-existing trauma in our lives. We've been really focused on the pandemic, but many students come to us with pretty significant stories. There's lots of things with family issues, alcoholism, drug abuse. They have very challenging coursework. They have difficult clinical experiences. There is relationship discord, especially, among this age group. Of course, the pandemic has put a great deal of stress on people. Mental health issues, definitely something we were seeing and that we continue to see. There's financial uncertainty. School is not an inexpensive endeavor, and many of our students were working full time. And so their job demands were significant. Lots of folks had professional obligations. And then the other reason resilience is necessary is because we want to help prevent burnout, depression, et cetera, from our colleagues that are in the workforce. So we made this decision to focus our efforts on providing a resilience program, because we know that resilience is adapting well in the face of adversity, right? And so how do we do that? We have to use internal strengths, which looks at how we feel about ourselves, our own intellect. We have to use our curiosity, our friendliness, and we have to use our external resources, our culture, our social resources, our friends, our coaches, our church family, which, as I'm saying these things right now, I'm thinking about Dr. Kim's research project that looked at the importance of social support, of spirituality, and building resilience. So this is all very well evidence-based. So we also know, as I told you, that resilience can be learned, and it can be operationalized, which it has been. It can be taught. And the outcomes of various resilience programs include an increased ability to cope with adversity, definitely increases community connection. And when I talk about our program in just a moment, this is probably the most significant outcome that we've definitely seen. It increases academic engagement and reduces competitiveness. We've also noticed that is something that has really been a wonderful thing to see with our students. It also decreases depression and anxiety. So what does the evidence say? What should we do with this idea of resilience and these programs that are popping up around the country? Experts say we need to use a strengths-based approach, which is really a student-focused approach, and that in doing that, we need to look at life skills. We need to look at coping strategies. We need to look at that idea of self-efficacy. How do we deal with certain situations? And then the other piece that would be really important when looking at a resilience program would be the mentoring and or social support. So we looked at all of those things. I'm going to actually skip this part. I put this in for my research friends because it does have a theoretical framework. We use the social ecology resilience framework for this program. And our story begins with Barb asking me to consider putting together something for the students. I had a colleague at the University of Massachusetts who shared with me a program that she was doing with athletes. And she talked about working with them. She did 10 sessions. It included mindfulness. It included some theory about what stress does to the body. And it included social support. And I thought, well, that sounds like something that I think would be fabulous for our students. Different population, but I really liked what she told me about her program. So I spent time with her. At the time, she didn't have any of this written down. It was all in her head. So I had to mine that information out of, she is also a researcher, had to mine the information from her. And we did our first cohort about 6 years ago. She does it normally with 10 athletes. I did it the first time with 150 students right after their clinical day. So let me tell you, it was a huge challenge to be able to engage students in that way. What we used is her model of resilience, which is called we call it the ABCs: active coping, building strengths, cognitive flexibility, and social support. And we did that for 2 different sessions. During the second time that we put them through the program called Changing Minds, Changing Lives that Dr. Jenny Chandler had developed, we had 75 students the second time. The third time, we took a break and kind of decided to reevaluate what we were doing. During that semester, we continued to hear from students, well, where's the resilience program? I thought we were going to be doing resilience. That was a really cool program. Why did the sophomores get it and we didn't get it? You know, hearing those kinds of things. So we took that as a green light to go ahead and continue developing this program. At this time, I am very happy to say what we have done is we did take Changing Minds, Changing Lives, and we started our resilience sort of initiative with the sophomores, the sophomore class. It is the same program at University of Massachusetts. It is part of a research study that has been continuing now for about 6 years. And currently we offer at the sophomore level during their fall semester a 1-unit course entitled Changing Minds, Changing Lives. And I'm going to actually, at the very end here, read you someone's final presentation. And that will let you know how the students respond, react, and feel about the course. Now, the second piece we added was a piece that looked at compassion, and not just compassion for others, because our students were very well versed in that regard, but compassion for self. This was something that was very foreign to them, very uncomfortable for them. And so we introduced that this last fall. Again, it's a 1-unit course. It is at the junior level when folks take OB and pediatrics. And this will be, we will be starting our second round of mindful self-compassion. Again, an opportunity for them to learn strategies, for them to learn about how to care for themselves, to recognize that yes, there is suffering and we have a remedy for that. It's called kindness. It's called compassion, right? The third component is something that I piloted last year, and it is something that I'm currently training 3 faculty to teach with me, and that is a course called PATH. It's replacing what we used to have, what we used to call Nursing 150, Caring Faithfully. And it is a course that all freshmen will have, pre-nursing students. They'll have it their second semester as they're preparing to apply for the nursing program. It is a course that was developed at Northwestern University. And Again, I have to say I'm good at begging people who develop beautiful programs to allow me to put them together for other populations, and we were lucky enough to do that. This is a course that is actually preparing students to thrive in an academic and psychologically very challenging environment by giving them different learning strategies, different strategies around compassion, and building new kinds of skill sets. And then finally, senior year, what that will look like, that will start next fall. I'll be looking for alumni, so if any of you are interested, I would love to have you on the team. It's going to be called the Mindful Nurse, and it's going to be about transitions to practice. So we will have alumni come in once a week for an hour, do more of a psychoeducational group with prompts around what is it like to transition to practice. Because while we think that the sophomore year is the most stressful of all the years, seniors would argue that it's the senior year when they're getting ready to go out on their own, to decide where they're going to live, where they're going to work, et cetera, et cetera. So as you can see, this is a three-pronged approach that we provide students with dedicated programming in each year of their nursing program, and it is part of their academic workload. It is not something that they can choose to opt out of. It's something that we are requiring. We feel that strongly about the importance of building resilience. We also offer students and faculty the opportunity to act with each other once a semester. We have kind of a resilience support day. And then the third piece is that we are integrating resilience building activities into each nursing course to reinforce the developing strategies that we're working on, the attitudes, the different capacities. And I will say each of our faculty are very well versed at adding resilience building activities. So just to sort of end, I want to share with you one of the things we do in Changing Minds, Changing Lives, the sophomore level year, is they do quite a bit of writing as a way for their voice to be heard and a way to express themselves and in a way for them to learn empathic skills, truly, to listen to someone else. So they're asked at the end of the semester to talk about what they learned. They can do a PowerPoint, they could write a song, they can be creative. And this is something that one of the students wrote, describing what she learned from this semester. It's called I Am Resilient. Do you ever realize that you're trying to do it alone? That the weight you've put on your shoulders is simply too much and all that you're striving for seems distant and out of reach? Because I have too, and I think we all do. And what I've learned is it's okay to ask for help when you never have before. That it's life-giving to learn about yourself and what brings you rest. That it's scary to let people in, but the warm glow of acceptance is well worth the first few minutes of vulnerability. At the end of the day, I am me and you are you. But what you have to remember is this: nobody expects you to do it all on your own. You are surrounded, you are loved, you are capable, you are worthy, you are resilient. There is nothing and there will never be anything that you cannot get through. And while I am me and you are you, remember that although we both carry different weights, different struggles, different regrets, we also both offer different strengths, different gifts, different perspectives. Sure, there will be days when you fail to recognize this, but in those moments, please don't forget that you can lean on others to remind you of all that you are and all that you can do. So when you find that you're doing it alone, that you simply can't go on, that something needs to change, extend to yourself the same grace that you so easily give to others, and remind yourself that you are surrounded, you are loved, you are capable, you are worthy, you are resilient. Thanks for listening. And I will really try to come over here and stop sharing my screen. There you go.
Thank you, Chris, so much. Oh, those last words really touched my heart. I so appreciate you sharing all of that. Thank you again to all of our faculty, our alumni leaders, and our volunteers for their efforts in making this event this evening possible. This concludes our time together this evening. The recording of this session will be made available within the next couple days on the Homecoming website, where you can also discover upcoming events where we would love to see you. You will also be emailed with an evaluation form if you would like to receive continuing education credits for this session this evening. But thank you again, all of you, for being with us this evening. Know that we are so thankful for you, our PLNU nursing community. God bless.